So the first step of taking x-rays is obviously to turn everything on. So to turn on the developer, you twist this like so, and then hit the on button. We usually give this about 10 minutes or so to warm up before we start using it. To turn on the actual x-ray machine itself is this left button right here. So you push that. Wait for this to start up. Then you're going to go ahead and push OK, and then reset, and then your x-ray machine is good to go. So then your next step is to fill out the form right here with your patient's information. You are going to fill out their first and last name, their date of birth, the date the x-rays were taken, and what views that you took. So you would either write cervical, thoracic, lumbar, or full spine if you took all of the above. And then you're going to write your initials for who took the x-rays. So the next step is to grab one of the bigger x-rays. These are for lumbar and thoracic x-rays. So we want this over here. Always make sure that this clamp is in the top right corner, so the doctors know which side of the body they're looking at when they're looking at the x-rays. Okay, so for lumbar x-rays, what you want to do is turn on the lamp. It's going to be set at 40 inches away from the patient. Then you're going to find the top of the iliac crest, which is the top of the hip bone on the patient. So about right there. And then you line up the side of the crosshairs with that spot. So you would line that up just like that. Make sure that the x-ray film is lined up this center dot with the light. And then you go ahead and slide it back in. Take this, and then you're going to measure the patient from right in the center of the light, just like that. And then you'll enter that in when you take the actual x-rays over there. And then for the lateral view of lumbar, you're going to have the patient face the wall. And then go ahead and rest your palms just on the front, just in front of you. And then take a little bit of a step forward, just right there. And you don't have to realign this, it should be lined up from the AP view. And then you'll do the same thing. Measure from the center. And then you'll enter that into the x-ray machine when you take the picture. Cool. Okay. So for the thoracic AP view, where you want to line the light up is right about at armpit level, so right about here. And then you'll do the same as last time. Make sure that this center dot is lined up with the light on the x-ray film to make sure that you're getting it completely nice and centered. And then you will take your measurement from the center of the light again. And then for the lateral view, you're going to do the same as with the lumbar x-rays. You're going to have them face the wall and rest their palms right in front of them, just like last time. And just like the previous time, the x-ray should be lined up just from the first view, so you shouldn't have to adjust anything. And you will take your measurement again. And you go ahead and enter both of those into the x-ray machine when you're taking the picture. Okay, so for the cervical x-rays, you're going to want to use the smaller x-ray films. And to set these up, you're going to slide this little device up like so. And then again, the center dot's going to go right aligned right here. So go ahead and tighten that in. Raise it up to the patient's level. So for this one, you want to go ahead and shut your eyes for just a second so I don't blind you. For this one, where you want to align the light is right along with their uvula. So go ahead and move just a little bit to your left, right there, and then back up just a smidgen. And then the same as last time, this light's going to be lined up with the center dot. You want to make sure you do that every time, just so you're making sure to use the full film. And then the measurement for this is just the width of the neck. Now for this x-ray, you're trying to get a picture of the top two vertebrae in the neck. So you're going to have the patient, when you're getting ready to take this actual x-ray, have them open their mouth as wide as they can so the teeth don't get in the way of the view. And then for the lateral view, you have them face the wall again. But for this one, you move the machine back to 72 inches. And then you line up the light with the back of the jawbone. And for all of these x-rays, you want to make sure that all jewelry is taken off just so you get the clearest possible picture. And then you won't have to take a measurement again because you're just using the same measurement from the first one. Okay, so this is how you adjust the size of the light for each individual x-ray. For the thoracic and lumbar views, you're going to want to keep these on 14 and 17. That just represents the size of the film. And we have these circled so people won't forget. For the AP cervical view, you're going to go to 8 and 10, which is the purple circle. And then for the lateral cervical view, you're going to go to 8 and 10 again, but that is the green circle.